The other treatment that's shown to be basically equivalent to surgery is radiation. And radiation is given by a radiation oncologist. They specialize in delivering radiation to treat or cure all types of cancers. But prostate cancer is one of those things that can be cured with radiation. Radiation can be delivered in multiple ways, in multiple different protocols. It can be external beam, where they map your prostate three-dimensionally, and you come in for 4 to 8 weeks, walk in, get the radiation, walk out. There's something called brachytherapy, where they insert needles into the prostate while you're asleep, deliver the radiation, take the needles out before you wake up. It's an outpatient procedure. You go home that day. So those are the two mainstay of treatments for prostate cancer. You know, the way radiation works, it's a radioactive isotope that destroys the bad cells and the good cells in a margin where you have to get the needles coinciding near each other to deliver the proper radiation to kill all the cancer cells. With radiation, it's the same type of side effects. You can develop incontinence afterwards. It's not as bad as surgery, but it's a trade-off because you may develop more irritative symptoms. Blood in the urine on and off. It may irritate the rectum a little bit, so you may have some fecal urgency. It's rare, but that can happen. And very rarely it can cause secondary tumors in the bladder or in the rectum, and that would be very rare. But those are sort of the treatment options when we talk about on this low-grade, low-stage prostate cancer. It's either we watch it with active surveillance, we do surgery, or we give radiation.
Or both.
Or both sometimes, you're right. Because sometimes what happens is that if you take out the prostate, and I think this is sort of where you may be at, if you take out the prostate and there is prostate cancer at the margin, or your PSA starts rising, meaning there may be microscopic cells around that area, you have a choice of watching it or getting radiation afterwards to the area where the prostate was to kill any microscopic cells that are there. With radiation, if you have recurrence, it's a little bit different because you never want to go and remove the prostate. Well, I wouldn't say never, but it's much harder to remove a prostate after radiation just because the planes that are there are sort of obliterated. It makes the surgery much harder. But what we have in our back pocket is something called cryotherapy, whereas patients fail radiation, you could put these cryotherapy probes in there and freeze the prostate, and that can give you a long-term result and cure from that too. So you're right, sometimes we do give both. Yeah, they've gotten away from the seeds a little bit. They do what's called high-dose brachytherapy now, where they don't leave seeds in, they just leave these probes in while you're asleep, give the radiation, take the probes out, so you don't have anything implanted in you. You're right. Very, very rarely they can travel, and sometimes there's been reports that these have traveled to the lungs. They've gotten to the bloodstream and have traveled to the lungs. It'd be very rare for that to happen, and there's still very good radiation oncologists that use the seeds and are very good at them, and they like them. But most radiation oncologists have switched to the either high-dose brachytherapy, which are the rods they put into the prostate while you're asleep, or the external beam therapy. And sometimes, honestly, they use a combination of the two, depending on the architecture of your prostate once they three-dimensionally map it. So you can have both of those together.